Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. This week, we'll be discussing two topics. First, the proposed fiscal year 2026 federal budget could gut funding for key federal health agencies. What's on the chopping block and why patients should care. Then we pivot to some good news, a major new partnership between GHLF and Walgreens that's using pharmacist power and support people with chronic conditions. Let's get into it. So first, as I mentioned, the federal budget is facing a proposed 26% cut for health and human services, dropping its overall budget to $93.8 billion. This is beyond just belt tightening. This is restructuring what public health is likely to look like in the United States. The largest hits to flagship agencies include the NIH, that's the National Institute of Health, which is going to be cut 40%. The CDC, which we talk about a lot on this program, is going to be cut 44% under this budget. Indian Health Services will be cut 30%. There will be commensurate cuts also at tinier sub-agencies such as HRSA, plus the entire elimination of programs that support low-income communities. The NIH cuts, let's talk about that. This isn't just about labs or scientists in white coats. NIH research impacts cancer treatments, disease funding, Alzheimer's trials, all sorts of diseases. The pipeline patients are counting on. With these cuts would slow or halt promising clinical trials. The CDC cuts, we're talking about surveillance for infectious diseases, vaccinations, emergency preparedness, all things that we all should care about. Post-COVID, this is like pulling out the airbags while we're still driving on icy roads. The Indian Health Service cuts. The Indian Health Service already struggles with funding and provider shortages. What's cutting $900 million going to do to this agency? It's going to mean fewer clinics, longer waits, and avoidable deaths in Native American communities. This is a justice issue, not just a budget line. HRSA and community programs. HRSA helps support maternal care, rural health, and workforce development. It also funds our federally qualified health centers that provide services for those in need. Elimination of many of these grants means stripping away the very support structures that keep vulnerable patients afloat. So, what comes next? Well, a proposed budget is, of course, not a done deal. It's, as they say, the opening offer in a long negotiation. Congress will weigh in, advocacy groups like GHLF will push back where needed, and appropriations battles will unfold over the next year or so. Expect major advocacy from groups like GHLF, medical associations, and public health coalitions. The big question is, what will voters and constituents demand? Public pressure can help change the game and ultimately decide what is in the final budget. So what can you do? Well, if you want to push back, if you want to insert your voice, call your member of Congress, especially if they sit on appropriations or healthcare committees. Spread awareness. Share this episode. Let's make budget policy personal, because for patients, it always is a personal endeavor. Turning to our next topic of the day, in brighter news, GHLF is partnering for Walgreens, and it's a win for those dealing with skin health. I'm incredibly proud to announce that our team here at the Global Healthy Living Foundation has launched a new national campaign in partnership with Walgreens that brings much-needed attention to under-recognized skin conditions. It's called Your Skin, Your Health: How Pharmacists Help You Take Control. The focus is on empowering patients with conditions like hidradenitis suppurativa, or HS, as I will call it for the rest of this episode, along with diseases such as psoriasis, atopic dermatitis, and alopecia, not just with information for patients, but with guidance patients can act on. So what makes this campaign different? Well, first off, it starts with a pharmacist. This is the often overlooked frontline health professional who is a trusted, accessible, and regularly helps patients navigate chronic and often stigmatized conditions. Instead of diving deep into medical diagnoses, each video zeroes in on how pharmacists can help, from symptom recognition to insurance navigation to holistic treatment and support. Why are we doing this now? Well, we're currently in HS Awareness Week, which runs from June 1st to June 7th, and our GHLF campaign kicks off with a powerful patient story and pharmacist insights. New videos will follow each week throughout June, spotlighting different conditions and strategies for pharmacist-patient collaboration. We're using GHLF's digital channels, reaching 2 million plus people per month, and Walgreens will amplify the message through its own massive network. Content is available on platforms like YouTube. Yes, we've got the official health info badge, and drives viewers to tools like Getting Clear on Psoriasis and the HS Patient Guide. We'll drop a link in our show notes with more information about this great initiative and more links for where you can find us on YouTube. Why does this matter? Well, this is about more than just awareness. It's about validation. These are conditions that people often suffer from in silence. As GHLF's co-founder Seth Ginsberg said, real patient engagement is possible and powerful. With this partnership, we at GHLF are proving it. What makes this kind of collaboration effective? It meets patients where they are, online, uncertain, looking for trusted help. It pairs patient storytelling with actionable advice, and it turns everyday pharmacy moments into extended care opportunities. Pharmacists aren't just people who count pills, they're educators, advocates, connectors. This campaign helps bring that reality to light and makes it easier for patients to recognize their role in our care. Well, that's all for this week's episode of The Health Advocates. We've covered a lot, from federal budget implications for patients to a new GHLF Walgreens partnership focused on skin health. Well, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.